Happy Tuesday. Hope everyone enjoyed their long weekend. But good morning, Queensland. Good morning to all of our Facebook Live followers. And in some good news today, we have 2 new local cases, but we are not too concerned about them. So let me go through them. The first is a 3-year-old girl, and she's linked to the family in relation to that aviation cluster and detected in home quarantine. So that's very good news. And secondly, we have a person who was coming in from Victoria, so was interstate acquired. It's a 19-year-old woman, and she was detected on arrival into Brisbane. Now, Dr Young will just go through that flight number. So she would have been infectious on that flight, but she was very much just, straight after she landed on that flight, she was intercepted, so that's fantastic. So we had 8,690 tests in the past 24 hours. So we do want to see more testing. So if you have any symptoms, Queensland, please come out and get tested. And Queensland Health did 11,587 vaccines. So that means that we have now 67.58% of eligible Queenslanders that have at least 1 dose, and 48.67% are fully vaccinated. So that's great. So we should get to that 70% of people with that first dose by the end of this week. So that's absolutely great news. So Queenslanders, please come out and get vaccinated. And now 2 million Queenslanders are fully vaccinated. But as we know, these issues, this Delta virus can pop up at any time. So please go and get vaccinated. There will be a text going out today as well from midday. So we'll be texting as many Queenslanders as possible. So if you see a text on your phone, that's a reminder to go and get vaccinated. And that might prompt you to go after work or go during the day or when you pick the kids up from school to go and get your vaccine. So that's something that we're also very interested to see. So I might hand over to Dr Young.
Thank you, Premier. So yes, 2 new locally acquired cases in Queensland today. Neither of them I am concerned about, but I do need to see more testing to make sure that we don't have any spread from our current 2 clusters. So one of these cases is related to the aviation outbreak. It's a child in a family that's already had positive cases, so the child's been in home quarantine for their entire infectious period, so there's no concern there. The second case is a woman who was given an exemption to return home. She normally lives in Queensland. She'd gone down to Victoria and she was given an exemption to return and go into hotel quarantine. She received notification on the plane, on the flight up from Melbourne, that she was a positive confirmed case, and we were notified as well. So we met her, Queensland Health met her at the airport and immediately transferred her to Royal Brisbane and Women's Hospital for ongoing care. So she's not a risk to anyone either. But of course anyone on that flight, because it came from Melbourne, is already required to quarantine, and we'll just more closely work through with anyone who sat in those seats near her. So just in case people are interested, that was flight JQ562 from Melbourne yesterday. And so we now have those 2 clusters. One cluster is the aviation outbreak, and I'm confident that due to the work done by the contact tracers and by the business involved, that everyone is in quarantine who's at risk from that outbreak. And then we have the second cluster, which is 1 person at this stage, that was announced yesterday, and we're just continuing to work through all of the contacts through the QR code process and working through with the businesses that she attended as to whether there are any cases. But I am reassured because in the last 7 days here in Queensland we've done over 112,000 tests. So we were doing those, of course, because we're focused on the aviation cluster, but we would similarly have found if we had any transmission from that person announced yesterday, given she'd been infectious in the community from the 23rd of September. So it is really important. Please continue coming out, any symptoms at all, particularly if you live in that Brisbane, Redcliffe area, Moreton Bay area and down to the Gold Coast, any symptoms at all, please come forward, because we have had a lot of people out and about infectious in the community. The good thing is that we're starting to see more and more of our people who are confirmed cases being double vaccinated. And we know that if you're double vaccinated, that reduces your risk of transmitting the virus on, if you become infected, to 25%. So you have 1/4 the risk of someone who's not vaccinated from passing on the virus. So that's what's reassuring here. And today, as you heard from the Premier, we tipped over 2 million Queenslanders aged 16 years of age or older have now been double vaccinated, which is a fantastic result. Now I would like all the rest of the Queenslanders to come forward and get their vaccine. You can walk in without an appointment to any one of our many clinics throughout the state. Just go online and find your closest one and turn up there. If you have a booking, you can turn up early. Don't wait till that booking. If it's in late October, November, come forward now and get your first dose. For your second dose, you need to have 3 weeks between the first and second dose of Pfizer, 4 weeks for Moderna and 12 weeks for AstraZeneca. It's really important to come forward and get that second dose, because we know you need a second dose to reduce your risk. There is some reduction in risk with the first dose, but most reduction occurs after the second dose. So don't wait until we have an outbreak. As we see every day, we're seeing cases that, due to the good work of Queenslanders, we're managing to get on top of, but that can't last. We are going to get more and more cases of the virus coming into Queensland. There are so many different ways it can get in. The best way to prevent any significant outbreak or any significant amount of infection and disease is to get vaccinated. We have plenty of supplies of vaccines, so please, anyone who is 12 years of age or older, come forward and get vaccinated. Thank you.
So some really great figures, Queensland. When you look at our testing, our checking in and our vaccinating, we've had over 112,000 people get tested since last Monday, and we encourage people to keep coming forward and getting tested if you have any symptoms whatsoever, and of course checking the website for any new exposure sites. When it comes to our check-in app, we have had over 500 million check-ins on the Queensland check-in app, 514 million check-ins. So well done, Queenslanders, for making sure that you are checking in wherever you go, which means it makes the job of our contact tracers far easier, and it means we can find the virus in the community by contacting people much quicker. And of course our vaccination rate, it's fantastic to know that over 2 million Queenslanders are now fully vaccinated. But we want to see everyone vaccinated who is eligible. So come out today to any one of our community hubs that are all walk-ins and get vaccinated, or make a booking with your GP, or go to your community pharmacy. There are so many options now, but the vaccines and where to get the vaccination, there is no excuse, no reason to be delaying getting vaccinated. Now, I just want to briefly touch on the commentary from the Commonwealth. We've heard the Prime Minister particularly focusing on Queensland when it comes to the request for the Commonwealth to be supporting state and territory health systems and the primary and allied healthcare system. Interestingly, and I remind the Prime Minister, that every single state and territory health minister signed this document. But not just one document, there's actually 3 letters sent to the Commonwealth Health Minister, and every single state and territory health minister has signed that. So this is a national conversation. It's not a fight between the Commonwealth and Queensland. It is every single state and territory saying that our health system was under extensive pressure and demand prior to COVID that required a rethink in the funding model going forward. And with COVID now, we need to see more effort, more contribution from the Commonwealth, partnering with us 50-50, which is only fair considering the responsibility of the Commonwealth in relation to our national health system as well. So I do remind the Commonwealth, this isn't just about Queensland and the federal government. This is about every single state and territory saying we need to work together to make sure that our health system is properly funded going forward.
Thank you, Premier. So just a reminder that our borders remain in place. So 7,623 vehicles were intercepted yesterday. We had to turn around 105 and 5 persons were placed into quarantine. In addition, we issued 5 on-the-spot fines. That's disappointing, including a heavy vehicle driver that was attempting to smuggle a female person into the state and was discovered by police. Then drugs were discovered on that truck driver in that truck. That person will appear in court and they were refused entry into the state, and both were fined for coming across the border in an unlawful manner. So, look, the reminder is there for everyone coming into our state that we will continue to check at the borders and make sure people are complying with the directions as they stand at the moment. At our air borders domestically, we saw 147 persons into quarantine and 12 were refused entry, so people are still trying to get into the state when they shouldn't. So please make sure you have the appropriate passes. Masks, 30 were handed out yesterday. There was 1 person fined at Roma Street Parklands for not wearing masks. The reminder there is, again, we are in increased restrictions, particularly in Brisbane and areas in the southeast and Townsville. Make sure you do carry your masks and wear them when you should, and avoid having to get a $204 fine. And finally, we will be thorough. A person who was refused entry at the Gold Coast borders during the day and fined and turned around, persisted and was then later located at Coolum and was arrested and will be placed before the court for their efforts as well. So we'll continue to police the directions as they stand, and we need the community to work with us. Thank you.
Sorry, Deputy Commissioner, is there any sort of criminal investigation in relation to the masseuse who tested positive yesterday?
No criminal investigation, but we are assisting health with trying to go through all the movements and associations with that person.
Can I just check with the vaccine mandate for the police service? Are you getting anyone that's, say, resigning from the police service over this, or do you have a gauge of how many?
Look, the numbers are quite low. We have had some people resign, and that number's changed on a daily basis, but the numbers are low. We expect at the end of the day there will be very few numbers that will refuse. Some people will, and we're working through that at the moment.
How low?
Look, I'm saying a handful per district across the state. We're collating those figures as we speak at the moment. We'll have a clearer view later in the week. Thank you.
Dr. Young, are you surprised we haven't seen any more cases from that masseuse, given how long she was infectious in the community before?
Well, as I mentioned, she was fully vaccinated, and significantly so. It had been over a month since her second dose. And we haven't seen any in her household. So there are 3 people who live in her household with her, and none of those are positive. Of course, 2 of those 3 were also fully vaccinated. We have to remember that not every case transmits. We've known that right from the start, and it's no different with Delta. But the issue is that we never know which case is going to transmit and which isn't. So, but I'm reasonably comfortable because of the large amount of testing that's been done that I think we don't have other cases out there. We need more testing so we can be sure of that. And also, masks make a big difference. And Queenslanders, particularly down here in the southeast corner, have been very compliant with wearing masks.
Do we know where she got it from, that genomic sequencing?
I do have the whole genome sequence back. And she does have Delta variant, as to be expected, and it's clustering most closely with some cases of the Delta variant in Victoria from middle of September. So it hasn't clustered with any known case in Queensland. It looks like some cases, not exact, but then Victoria, of course, because they've had so many cases, isn't loading all of their whole genome sequences on the national database. But where we have found the closest relationship is a number of cases down in Victoria.
How can our hospitals be prepared for a big surge in COVID cases when we have half of category 2 patients not being seen within clinically recommended times at 7, 8 public hospitals?
Yeah, thanks, Lydia. And as we know, these are pressures that are being felt right around the country. That's why the health ministers wrote that letter to the federal health minister. These are extraordinary times, and the pressures are not unique. and other premiers also raised these issues at National Cabinet.
We just heard from the Health Minister that our hospitals were under pressure prior to COVID. Why has it taken 18 months to raise this issue?
No, we've been raising it. Actually, other premiers have been raising it as well. So this is nothing new. This is in the height of this pandemic. It has been extraordinary to see the increased presentations, especially when we had that initial lockdown period.
The AMA has said the capacity issue has been a problem for years and years and years. How come we haven't seen a big increase in bed capacity?
Well, if you've read the letter, Lydia, the letter clearly states that at the moment too there's 600 people from memory that have either aged care issues or they have people with complex disabilities. That now Professor Murphy from the federal level said that they're actually looking at working with the states to help transition them into like aged care facilities, and that would help free up some bed capacity, which would be great for Queenslanders and great across the nation. And it's great to see the spirit of cooperation when it comes to dealing with these issues. So there should be more of it.
The Premier, the Prime Minister accused you of essentially trying to extort money and shake down politics.
I don't believe that, no, not at all. Look, what we do know is that we're dealing with a global pandemic. We want to make sure that, that our hospitals are getting ready. And we've seen, like, you only have to see what's happening in New South Wales and Victoria, and I think, Tim, we talked about this the other day, the huge pressure that the staff are going to be under, and they're constantly under this pressure. So, as Dr Young said the other day as well, working very consistently across the state, getting everything ready, because when we do have a large outbreak of Delta in this state, there's going to be added pressure. And that's not just happening in Australia, it's happening across the globe. These are unprecedented times.
So categorically, do you think our hospitals are ready?
Categorically, I think we have all of the processes in place. People are working incredibly hard around the clock. But this is the golden moment in time to get vaccinated. This is what we need. The more people who get vaccinated, it's largely the pandemic of the unvaccinated at the moment. So what we are seeing, the evidence is in New South Wales and Victoria, that people who are ending up in ICU are largely those people who aren't vaccinated. So we need to get as many people in Queensland vaccinated as possible, and that will then ease the pressure on the hospitals when the outbreak does come.
But do you think they're actually ready?
They're doing everything they can.
But
Everything they
ready?
can.
Are
Well, I think that's a bit of a hypothetical question, because they haven't had to deal with a Delta outbreak like New South Wales and Victoria before. So, yes, they're getting prepared. They're getting prepared as much as possible. We're very fortunate to have Dr Young, who has been preparing Queensland for this pandemic in the eventuality of a pandemic. So they're doing all the preparations, but this is a national issue. It's a global issue. We are in a pandemic. Sorry?
When will Queensland release its plan?
Queensland's working with the Commonwealth, so the Commonwealth is actually working on a national plan looking at the capacity issues, and that's coming back into National Cabinet.
Do you think the borders will be open by Christmas?
That's another hypothetical question, and what we want to do is get as many Queenslanders, I hope so, we've got to have as many Queenslanders as possible vaccinated, but we're not going to do it unless it's safe to do so. So, we are not going to put Queenslanders at risk until we get to those vaccination levels. So our target is to get that 80% fully vaccinated across Queensland, but we would like to see more people vaccinated because that will ease the pressure on the hospital system.
Will the borders open up that 80%?
Not necessarily. It depends on the situation of the day. It depends on what's happening in New South Wales and Victoria. So we are watching all of those issues very closely. Everyone has those targets of getting the 80% double vaccinated, and that is exactly what we are working on. At the moment, we're getting close to 70% first dose by the end of this week, but we want to see in Queensland as many people as possible. Now, in ACT, from memory, around 93%. 93% in the ACT have now had their first dose. So it is possible to drive up those vaccination rates, but it's going to mean a huge effort on Queenslanders' part to go out and get vaccinated.
This is why
And I love people sending me their photos of getting vaccinated, and like I said the other day as well, people were coming up to me saying that they're vaccinated.
This is why the question of hospitals is so important, because I know last week you said you won't open up until the hospitals are ready. Chief Health Officer
I said we need to look
ready.
at across the across
The
the
Chief Health Officer says they're
yeah.
ready. The
We need to
Deputy
look.
Premier says they're ready.
We need to look at making sure that our hospitals are ready, that the plan's there, and that is exactly what the National Cabinet is looking at. The capacity right across the nation. That's great work that's happening there. Professor Murphy's sort of been helping to drive that work, and then we need to look at the plan for the children, and we need to get our vaccination rates. So, you know, I think it'd be negligent if I wasn't looking at all of those issues. Like, we all have to look at those issues so we can be as well prepared as possible. And, you know, we don't want to see a massive Delta outbreak here. We have got this moment in time to get vaccinated, everyone. So please go and get
You
vaccinated.
understand the concerns in the community, but especially the people whose livelihoods depend on open borders. When you can't bring yourself to stay, I guess the hospitals are ready.
Well, I think what we can say is that in lockdown, businesses aren't operating. That's what we can say. That's very clear evidence. We have lockdowns in Victoria, lockdowns in New South Wales when the Delta virus gets out of control. That's fact. So what we are trying to do is minimise that impact by getting as many people vaccinated now as possible. So, you know, we're fighting to protect our freedoms at the moment, and they're fighting to regain their freedoms.
Premier, the government.
I'll just do a couple more because I have another announcement.
Premier, the government.
It's appropriate that cabinet ministers are taking a day off in the middle of the week to attend a federal Labor election campaign fundraiser.
Who's taking a day off?
A number of cabinet ministers.
They're not taking a full day off. No, they're not. They're not taking a full day off, Lydia. No.
Premier, the government announced that $100 million some months ago for 65 new beds to ease the pressure on hospitals.
Sorry,
The $100 million package the government
yeah, I'll
announced.
get a vet to talk about that.
But have those
Yep.
65 beds come online yet?
Oh, you'll have to ask the Health Minister. Yep. So, any questions for the Health Minister? Then I've got another announcement. Yep.
On New South Wales, if we could, they have a new Premier, Dom Perrottet. Have you spoken to Gladys Berejiklian, and are you looking forward to working with
Look, I'm waiting to see. I heard there's some commentary. Look, I'm going to wait till that's all fully endorsed and announced. Yeah. Okay. Well, I'll reach out to him, and I made comments about Gladys. Okay.
Have you spoken to her, though?
Well, I haven't had the opportunity. Okay.
Premier, with the vaccination rates, at the moment it has to be the national at 80%, states at 80% average. What happens when there's some pockets of the community that have very low vaccination rates?
Well, we're looking at that. So I get those. I look at some data each and every week, and I look at that, and we're looking at some of those pockets. And we need to make sure that we do bring those vaccination rates up across the state. So we're doing some extra planning on that. Those text messages going out to people is one way to get people to think about, hang on a minute, I do need to get vaccinated. Yep. Okay. No, I need to make another announcement. So I need to get a vet to answer this question. Okay, because then I've got cabinet. So thanks.
So which question are we?
Minister,
Oh, the 100 million, sure. So yes, those beds have come online, but remember that was funding that we announced around April, May this year, and we also have put in, since budget, another $163.5 million to open up additional beds as well. So all of those beds are being brought online between now and the end of the year, but our demand is significant, and this is what every health minister is saying, that the demand through population growth, through ageing population, increase in complex illnesses, preventable illnesses, less GPs, less bulk billing GPs, less access to allied health, not getting into an aged care nursing home, not getting disability support. Every single one of those things impact on the public health system. And so that's why we're all working together to find solutions on all of those, because it's not simply about the public health system.
Are you concerned, Health Minister, as frontline Queensland health workers who are locked out and can't get back to the state? Is a hotel quarantine?
Look, I've heard some figures of, I think, a paramedic wanting to come back. Our healthcare system is running in Queensland. We have no disruption to continuity of care because of anyone who has travelled interstate and is unable to get back at the moment. So, we ask for their patience, as we've said. Every hospital is making sure that they've got continuity of care in relation to any staff, whether they're on leave, because whether they're interstate on leave or whether they're taking leave here, staff take leave. We don't have 100% of our workforce at hospitals at any given time. So we manage that leave as we always have.
Right. So I would like to introduce Queenslanders today to our new Chief Health Officer. So if Dr. Crispin Hajkovic could just come in. And thank you, Doctor. So look, for over 600 days, Dr. Young has stood by Queenslanders' side as we've battled this pandemic. And of course, next month, Dr. Young will take up the Distinguished High Office of Governor of this state. There has been an extensive recruitment process, and I'm very pleased to announce that Dr. Crispin Hajkovic will take on that role from the 1st of November. So Dr. Hajkovic is the Director of the Infectious Disease Unit at the Royal Brisbane and Women's Hospital. He has managed pandemics and has more than a decade been involved in the management of that, including the 2009 flu pandemic, Ebola, and do I pronounce it Zika? Zika, yep. And he has worked in Brisbane, Rockhampton and Gympie, as well as interstate as well. He is also the Associate Professor at the University of Queensland Centre for Clinical Research and has an extensive record in research and has published more than 27 times in medical journals. So I just wanted to make sure that Queensland got to see the new face of our Chief Medical Officer taking on that role from next month, and I'm quite sure that everyone will be wishing Dr. Young all the best in her role. But I might just ask Dr. Young, do you want to say a few words to introduce Dr. Hajkovic and then say a few words? Thanks. Thanks.
I'm delighted that Dr. Hajkovic will be taking on the role of Chief Health Officer from the 1st of November. He is the perfect person to take on the role at this point in the pandemic because he has been our lead, and I've been going to him for the last 2 years for advice. He has been the lead in the treatment and management of COVID cases. And it is no accident that Queensland has only had 7 deaths out of our 2,048 cases so far. Every single one of those deaths I regretted, and we all regretted, but at least it wasn't more, and that was due to the work that he's done and led across our state. So I've had him involved in our network. As you know, we have 5 COVID hospitals networked in Queensland, and he's been the lead in working through with those hospitals and with our clinical protocols. And I know he's been keeping right on top of the new treatments that are available going forward, and that is what we will need going forward. So we're coming out of the phase of the pandemic, which was all about stopping the virus coming into Queensland, and Queenslanders have done a fantastic job doing that. But now we're getting to the point where we won't be able to maintain that. The virus will come in no matter what we do, so we need to have our health system prepared, which it's been doing now for over 18 months, and we need to have the systems in place. This is another disease that needs to be managed. And once we've got enough people vaccinated, we really and truly need to offer every single Queenslander the opportunity to be vaccinated if they're 12 years of age or older. Then we know we can manage this and manage it very well, particularly with someone like Dr. Hajkovic in charge and managing that going forward. Thank you. Thank you very much, Dr. Hajkovic.
Thanks very much. Thank you, Dr. Young. Thank you, Premier and Minister. My name's Crispin Hajkovic. I'm a clinical infectious diseases specialist. I've worked at Royal Brisbane and Women's Hospital on the front line of the COVID response for the last 18 months, managing patients in hospital, in ICU, vaccinating and so forth. So I've got a very good personal experience with this virus. I'm thrilled and honoured to become the next Chief Health Officer of Queensland. There's a big problem, which is it's going to be very hard to follow in the footsteps of Dr. Young, who is brilliant, outstanding and has the respect of all of the doctors, all of the nurses looking after COVID in the state. I'm honoured to be joining this team, and I think the results that Queensland has achieved in the pandemic to date speak for themselves. And I'm really honoured to serve the people of Queensland. Look at what we've achieved, and it's because of people getting tested, getting vaccinated, following the QR codes, doing all of that sort of thing. And the people of Queensland are really the main reason we are in such a good state at the moment. However, things will change with the pandemic. We have an opportunity here. We have an opportunity to get our vaccination rates up. So please get vaccinated. Do it today. Prioritise it over other things you need to today. If you can't do it today, make a booking online, do it this week. It takes time to get protection from vaccination, and we need to get on with it right now. I will be becoming the Chief Health Officer on the 1st of November. We still have a fantastic Chief Health Officer in the meantime in Dr Young, and I'm very grateful for your kind words and for the opportunity today. Thank you.
Why did you want the job?
Look, I've been involved in pandemics for a long time now. This will be my 4th big pandemic. It's a unique moment in history. This is by far the worst pandemic we've had. I have some really good ideas. I have a lot of knowledge about the virus. I'm a technical knowledge, infectious diseases vision, and I think that's the right time to have a clinical lead coming into the pandemic at this moment, where we're going to have a shift and we're going to be treating cases in hospital.
Dr Young, I guess Queensland has been very used to Dr Young's approach to COVID. Can we expect any different approaches from you, or is it going to be very much on the same path?
Oh, look, Dr Young has done a superb job. She's an outstanding communicator and has a deep knowledge of the transmission of the virus and so forth. I'm not Dr Young, I'm different. I come from a clinical background, but I'd be really happy to achieve what Dr Young's achieved, if you like. I'm not the CHO yet, so I'm looking forward to asking those very valid questions, but I'm not the CHO yet, and I look forward to answering them when I do become the CHO.
Dr. You've been on the front line of Queensland's COVID response. Are hospitals equipped to deal with certain cases that we're expecting?
Look, our hospitals are fantastic, and it's because of the fantastic people in our hospitals, the doctors, the nurses, the physios, the pharmacists, the allied health and the wardies. We have great people. I'm really confident about that. Now, COVID has tested hospital systems around the world, and it'll test our system as well, but we have fantastic people, and I'm confident that our hospitals will.
Do you think it's ready, the hospital system?
I think our hospital system is looking great. I think our hospital system has heaps of people ready to go. I think it'll still be a big challenge, though, yes.
What's your opinion on 18, 19-year-olds receiving AstraZeneca?
I'd follow the advice of ATAGI. I think Dr Young has always followed the advice of ATAGI, and that would be my position on vaccination. ATAGI is a group of experts. Many of my colleagues are on ATAGI, and I think they make great recommendations which we'll be following.
Okay, thanks everyone.
Thanks very much.
We've got a cabinet meeting now.
Thank you.